The Delta program has helped us evolve absolutely.
I feel like our original mission was to make sick people better, and now we are looking at things with a different mindset. What can we do to keep you well?
We had our community champion out both at the schools and at other town hall meeting areas, educating the community, encouraging them to be healthier, to get in sooner and get preventative care rather than waiting for an upper respiratory disease to drive them to my emergency room. And we actually had measurable results from that. We did see a decrease in the number of individuals coming to the ER for that. And it's indicative that population health can be managed. You can be successful. It won't happen overnight, but we can do this. And it is so beneficial to get ahead of acute episodes of care by providing high quality preventative care.
A lot of our community members utilize the emergency room for non-emergency visits, and as a result we had a lot of preventable ED visits.
If you're filling up your ER beds with non-emergent care, when you get a true emergency in, that patient's going to be waiting.
So the transitional care model is really designed to keep patients from having to bounce back into the hospital setting or an acute care setting. So with that model in mind, from the moment of admission into the hospital, we are starting our discharge planning. So we are really trying to make sure that we're setting that patient up for success upon discharge, making sure they have everything that they need, whether that be follow-up appointments with their primary care or any specialists that they may require after discharge.
And the rate has been greatly decreased since the Delta grant has kind of came in and gave us ideas and different methods to keep those readmissions down.
So instead of having patients that are circling back because of chronic illness and chronic condition, we're seeing a higher rate of patients that are ahead of the game. So they're staying healthy, they're able to get these pre-existing health conditions and optional orthopedic surgeries and things like that.
So since working with the Delta grant, it has been proven that our readmission rates are down throughout the hospital in the emergency room and the medical floor.
We've had several months now where we've had no readmissions to our ER. So it's been a drastic change.
Working through the grant to provide community health workers that actually helped patients get on Medicaid. Once they were on Medicaid, they no longer needed to use the emergency room. They could go to a primary care provider to get their care.
What we've done is close the gap with primary care. We call and navigate 100% of our Medicaid beneficiaries through our navigator to the clinic. We have access. You don't need an appointment. We can get you in 12 hours a day, 7 days a week. It has been wildly successful.
We've seen very, very good results out of our ACO product, which is a case of making sure that people in our community is moving toward population health, better care, quality care, and people living longer, have healthier lives.
Medication errors were reduced by 75%. Hospital-acquired infection was reduced by 70%. Grievances went down 60%. This was all during COVID, so that was really profound for us.
The Delta program helped us make sense of it all, helped us prioritize and streamline how we measure our quality measures. We changed our format of our quality QA/QI committee to include cross-agency, cross-program involvement. board member rotating monthly involvement, and we highlight different measures that need improvement every month with a action plan, very similar to the action plan format that we received from the Delta program.
Our community members of DuQuoin are definitely healthier because of the transitional care and the care coordination that we're providing at their hometown hospital. I feel like it is one of the best things that we can offer. It meets our mission and our vision and what we're working towards. We really just want a healthier population overall.
We all want that. Everybody, whether you're in New York or little Clarksdale, Mississippi, you want good health care and you want to have it at healthy community.